We are on the Health Watch, as always, joined by Dr. Syed Hussain from Trinity Health in New England. And this morning, we are talking about dementia as we bring in Dr. Hussain. Good to see you.
Likewise,
sir.
Tim.
Glad to have you here.
Thank you.
They're expecting a huge influx in the number of people who have dementia, kind of like the price of progress as people are living longer, and that's an age-related disease. We're worried that maybe emergency departments might not be able to handle the influx, but I think you were just telling me a minute ago there's already a problem that could get worse. Talk to me about the problem.
Yeah, let's talk a little bit about it. So what is happening is folks are living longer.
Yes.
Those that are above the age of 65, the dementia rates in those people will be rising.
Yeah.
And what we currently see, as folks grow older, they have dementia, they have other medical problems, at some point they will seek medical care, medical attention, and come to the emergency department at hospitals across the country. We currently have an issue which is pervasive, all pervasive through, coast to coast, called ER boarding, where patients may be staying in an ER many, many, many hours. We just saw this phenomenon again during the most recent flu surge that we experienced a few months ago.
Right.
But if a patient has underlying dementia and medical problems, they're more susceptible to developing delirium, which is confusion, agitation, especially in the ER setting. So this is a complex problem, Tim. We need policymakers, we need healthcare systems, insurance payers, and innovative thinking about what to do with current labor shortages to come up with a more credible solution of how we reduce ER boarding times.
Okay, so is there any problem with how you're able to handle dementia patients when they're in the emergency department? In other words, is the delirium just because they're not in a familiar surrounding?
That's right, and they're waiting for an inpatient bed usually. Yeah. Right, but let me give another statistic here for viewers. So in 2003, we had 965,000 staffed hospital beds. Come 20 years later, 2023, it's down to 915,000 staffed hospital beds. So the American Hospital Association actually says post-pandemic, the number of staffed beds have gone down. That's why I say it's a complex problem. We need all key stakeholders at the table to come up with innovative solutions.
Okay, so we'll see if something happens in the coming days, weeks, months, and years. Moving on, there was a study out that said some maybe brain-harming chemicals are being released from children's mattresses. What's behind that?
Yeah, this is an interesting study that's from out of the University of Toronto. Basically looking at chemicals in the air in children's bedrooms. There are about 25 or so chemicals that they measured. And then what chemicals are in mattresses, for instance. Those that are phthalates or, flame retardants, UV blockers. Things in other areas such as toys are tightly regulated. Those levels were very high, found to be very high, which is concerning, which means we probably need to look at standards around mattresses, especially for children, because they're in that age group and they're developing quickly, and so they're more susceptible to developmental issues, reproductive issues, or neurological issues, based on previous studies that have been done that have looked at these chemicals in toys and other objects.
So just to be clear, it's not just that they're present, they're also present in abnormally and concerningly high levels.
That's right.
Yeah, so that is a problem.
So what can you do as a parent, though? Because viewers might be thinking, okay, what can I do now? I can't just throw away mattresses. So you could make sure that bedding is washed, aired. You use a vacuum cleaner, for instance. If there is a new mattress, maybe look at ways where we could sanitize it better. Those are things that we can do currently while we wait for new standards based on research.
Okay, that is good that there's something that can be done. Real quick, one more topic. Pfizer ending the development of a pill they were trying to see would treat obesity. The problem was, I guess, one participant in one trial experienced a possible drug-induced liver injury, an injury that went away as soon as they stopped taking that pill. Yeah,
it was enough to stop the trial. So Pfizer will be looking at other modalities, but this comes on the heels of, as most folks are aware, Wegovy and Ozempic and Zepbound, all these blockbuster obesity-fighting drugs. They're all injectable, though, Tim. So that's why there's been more efforts around, okay, what about an oral pill once a day or something along those lines? So this particular study has been stopped, but I know other drug makers are also looking at, there is research ongoing.
Yes, and at least there's some treatments, even if they're injectable, that do work. So that does help.
Yes.
All right, doctor, thank you so much.
Thank you.
Good to see you again.
Likewise.
As we always do every week.